I'm Dr Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on how long does my cornea transplant last? Patients ask me all the time, how long does my cornea transplant last? If I do a transplant, when do I have to do it again? Really depends on the type of the transplant. What I'm going to present today is longevity of something called stromal transplant, which is a structural layer of the eye. So what we do is we peel off that front layer, the structure. We leave the inner lining, the cells, and only replace the structure. That structure is important because it's like the glass. If the glass has a crack in it, or a scar in it, or a mark in it, you just replace the glass. You don't replace the inner lining, and that inner lining is critical because that inner lining is what fails or rejects, and that's why most transplants fail. If you don't replace it, your transplant won't fail for those reasons. So this is what it looks like. In the next slide here, you'll see that in the top, it's a full transplant. So the blue is the structural layer and the black on the back of it is the cells, and that's a full transplant. Now, I've shown you an irregularity in how it heals there because it can be tricky getting it to heal just beautifully. In the bottom is the layered transplant, the stroma, the structural layer. I peel off the front, and because the back is all intact, it just sits in place nicely. That means more regularity, but what it critically means is we don't replace the cells, we don't go in the eye, and that changes dramatically how long your transplant will last. Why do we do it? Here's a person who has a contact lens, they get an infection, they get scarring, they lose vision, they come in and go, I can't see, I want it fixed. And rather than replace the whole cornea, we peel off the front and replace that and give you clear tissue again. And I'm going to present you a case of that, and then I'll have a chat to you about what it means. So the patient is a young 14-year-old boy who wore contact lenses, came in with this and was legally blind. So what did I do? I did a stromal transplant. I sat him down with mum and dad and go, look, this is going to take a long time to settle down. My average time is 3 to 18 months for glasses and 3 years for it to settle the way I would like, so that it's absolutely stable so I can say, see you later, bye-bye, I don't need to see you again. Here's what he looks like at 3 years. Now, you can't actually see the transplant. It's a smaller one. Sometimes I have to do bigger ones, but it's there. And if you look really closely, there's a tiny ring. What I will do is show you one edge of it so you can see the edge. And you can see that now when I illuminate differently, you can actually see the edge, and there's little remnants of stitches buried deep in the cornea. No, I don't dig them out. They'll stay there with him. They're not affecting his vision. But I've taken away that scar centrally and replaced it. Key features here, I haven't gone into the eye. I haven't transplanted the cells in the back of the cornea that keep it clear, the cells that fail with a full transplant, the cells that cause rejection with a full transplant, haven't touched them. But it gets even better than that. If you have a look at the cells at 3 years, this young man is now 17.5. Let's have a look. On the right eye, his eye that is unoperated on, if you see he's circled in yellow, he has a cell count of 2,600. His left eye has had a layered transplant. His cell count is nearly 2,500. Measurement error, if you think about measurement error, that's no difference. In other words, he's got the same number of endothelial cells. What does that mean? That means that he shouldn't have problems. I've seen my transplants 25 years out. They look crystal clear, no problems. I can't promise you that you'll take this transplant to your grave, but that's my expectation, because you're not going to suffer rejection, nor are you going to suffer failure from cellular loss. So that's why I'm a big proponent of stromal transplant. I just did another one today. And generally, when I see these patients at 3 years, they're all stable. I say, look, pop back in 3 years, let me have a look. After that, see you later. And I've seen some of those patients coming in 20 years later for the other eye. Transplants look pristine. Of course, this is really important that they do not ever, ever rub their eyes, because it can change the shape. But it's a beautiful operation, very elegant operation, very rewarding and meaningful operation that restores vision. And patients can take it, I believe, to their grave. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and I hope that's answered your questions. Thanks for watching.